Welcome to this explainer. Today we're taking a look at something that honestly gets a bit misunderstood. People tend to think of breastfeeding as just this pure automatic instinct, something that just happens effortlessly, right? But the reality? It is an incredibly complex, totally fascinating biological system. And just as importantly, it's a highly learnable skill. It takes practice for both the mother and the baby.
Okay, let's dive right into this because the stakes here, they're absolutely massive. Over 1 million. That is the estimated number of children who unfortunately die every single year from diarrhea, respiratory issues, and other infections simply because they aren't adequately breastfed. So we're not just talking about food here, we're literally talking about life-saving protection.
To really wrap our heads around this vital process, we're going to take a structured systems approach today. We'll be walking through the benefits, the anatomy and hormonal reflexes, proper positioning and attachment, how to troubleshoot common problems, and we'll wrap up with milk expression and storage. So, starting off with Section 1, the benefits of breastfeeding, and really why this all matters so much. It turns out this biological system provides some massive mutual benefits. For the newborn, breast milk is basically the ultimate multi-tool. It gives them optimum nutrition, acts as their literal first immunization, and it's super easy for them to digest. It even protects against allergies down the line like eczema and asthma. But it's equally powerful for the mother. It actually accelerates the uterus returning to its normal size, delays the next pregnancy if it's practiced exclusively for the first 4 months, and get this, it lowers her risk of breast and ovarian cancer later in life. Plus, for society at large, it's highly economical and drastically cuts down on infant hospitalizations. It's really a win-win-win.
Now, the magic really kicks off in those very first few days with something called colostrum. This is that thick, yellowish milk produced right after delivery. It is absolutely packed with antibodies and anti-infective proteins, way, way more than mature milk. Think of it as a super concentrated shield for the baby. It also acts as a mild purgative, which is super helpful because it clears the baby's gut of meconium, that's their first stool, and that directly helps prevent a really dangerous condition called hyperbilirubinemia, or severe jaundice. Let's move to our second section and see how this builds under the hood, the anatomy and hormonal reflexes. So, looking at the anatomy, the breast is made up of glandular tissue, supporting tissue, and fat. The glands are what actually secrete the milk, which then travels down through tubules and drains into what are called lactiferous sinuses. Now, you can just think of these sinuses as little storage tanks located right behind the areola, the darker area of skin around the nipple. Surrounding each gland are these tiny muscle cells that contract to squeeze the milk out and right into those storage tanks. Now, what's really interesting about this next part is the fascinating dual hormone system running the show behind the scenes. You have prolactin, which we can call the production manager, and oxytocin, the delivery system. Prolactin is secreted by the anterior pituitary gland and basically tells the body, hey, make more milk. And its levels actually peak at night, which is pretty cool. Oxytocin, on the other hand, comes from the posterior pituitary and tells the body to release or eject that milk. It's triggered by the baby suckling for sure. But amazingly, it can also be triggered by just the sight, sound, or touch of the baby. Because oxytocin is so closely tied to a state of calmness, stress can really inhibit it. So something as simple as giving the mother a back massage can actually stimulate this oxytocin reflex and get the milk flowing. And all of this sets up just a perfect biological dance. On one side, you've got the mother's hormonal reflexes preparing the supply, and on the other side, a healthy newborn arrives, basically pre-installed with its own natural reflexes. When something touches the baby's cheek or lip, they instinctively turn their head and open their mouth. That's called the rooting reflex. When something touches the roof of their mouth, they suck. And when their mouth fills with milk, they swallow. They are naturally endowed with these abilities, totally ready to connect with the mother's anatomy. Which brings us right into Section 3, proper positioning and detachment, or the action phase. Now, while those reflexes we just talked about are completely natural, bringing them together effectively, well, that requires a bit of technique. Getting these physical mechanics right is absolutely everything, mostly because proper technique prevents some really painful clinical issues down the line. So there are 4 key signs of good attachment to look for. 1. The baby's mouth must be wide open. 2. The lower lip should be turned outwards. 3. The baby's chin needs to actually touch the mother's breast. And 4, and this is probably the most important one, the majority of the areola, not just the nipple, needs to be inside the baby's mouth so they can access those lactiferous sinuses we talked about earlier. And this brilliantly illustrates what it looks like when those 4 steps actually come together in action. Notice how the baby takes in a really large mouthful of breast tissue. Their body is well supported, they're facing the mother, completely aligned in the same plane. It's a deep, effective latch that allows for slow, deep sucks, maybe pausing occasionally, and you'd hear clear swallowing. But what if that technique is a little off? Well, it triggers a whole cascade of negative effects. Poor attachment straight up leads to pain or even serious damage to the nipple. Because the latch is shallow, the milk isn't removed effectively, which causes incredibly painful breast engorgement. And if the milk isn't being removed, the biological signal to the mother's body says, hey, we don't need this much, leading directly to a poor milk supply. Then you get a frustrated, irritable baby who refuses to suck, which ultimately results in poor weight gain. It's a real domino effect, and it all traces back to getting those initial mechanics wrong. Which leads us seamlessly into Section 4, troubleshooting common breastfeeding problems. First off, if things go wrong, do not panic. Almost all of these conditions are entirely solvable mechanical or biological issues as long as you know what to look for. Sore nipples? Usually caused by incorrect attachment, where the baby is just sucking on the nipple itself. The fix there is correcting that positioning, maybe applying some soothing hind milk to the area and just letting it air out. What about breast engorgement, where the breast becomes swollen, hard, and really painful? That usually stems from delayed feeding or poor positioning, where milk starts accumulating. You treat it with frequent feeding, local warm packs, safe pain relievers like paracetamol, and maybe manually expressing a little milk to soften the breast first. Now, if engorgement is ignored, it can lead to a breast abscess, which is severe and does require antibiotics and clinical drainage. And as for reduced milk supply, often it's just infrequent feeding. The solution? Feed more often, especially at night when prolactin is highest, and use techniques like back massages to trigger that oxytocin reflex. Now here's a really clever clinical intervention. For mothers who have flat or inverted nipples, which can make it super hard for the baby to attach, you don't have to just give up. A simple 20 milliliter plastic syringe can be modified just by cutting off the tip and reinserting the plunger backward. The mother can gently use this to pull and draw out the nipple right before a feed. It is such a simple, low-cost tool, but it completely empowers the mother to solve the mechanical issue herself. All right, finally, let's wrap up with Section 5, milk expression and storage, kind of the maintenance side of things. Look, we have to acknowledge modern realities here, right? Mothers return to work, or sometimes they deliver preterm babies who just don't have the coordination to suckle yet. In these situations, manual milk expression is a vital tool, and the physical technique for it is very specific. First, always wash your hands thoroughly with soap and water. Then, you place your thumb above the nipple and areola and your first finger below it. You press slightly inwards towards the chest wall, and then press and release those lactiferous sinuses right beneath the areola. It's a rhythm. Press, release, press, release. The crucial key here is to avoid rubbing or sliding your fingers along the skin, and never, ever just squeeze or pull the nipple itself. That doesn't actually help express the milk, it's just going to cause pain. Once you've got that milk expressed, safe storage is incredibly straightforward, but it's absolutely critical to get right. Expressed breast milk can be kept safely at room temperature for up to 8 hours. If you have access to a refrigerator, it can be safely stored in there for up to 24 hours. So, to tie this all together into some core protocols, these are the steps that ensure the biological supply perfectly meets the baby's demand. We want to initiate breastfeeding within the very first half hour of birth if possible. Ensure absolutely exclusive breastfeeding for the first 6 months. And by exclusive, we mean no water, no gripe water, no honey, just milk. Feed day and night on demand, which usually translates to at least 8 times a day. You can easily assess if the baby is getting enough milk just by looking for 6 to 8 wet diapers a day and a steady weight gain. And finally, continue this practice up to 2 years of age or even beyond, right alongside healthy complementary foods. So the really crucial point to take away from all this is, yes, breastfeeding might be driven by some truly brilliant natural biology, but succeeding at it, that requires education, mechanical skill, and real systemic support. Healthcare facilities need to implement the 10 steps to successful breastfeeding, which means training staff and supporting mothers continuously. Because when we treat this as a learned skill, one that's supported by a solid clinical system, we prevent illness and literally save millions of lives. So with the right technique, education, and support policies in place, how can we help every single mother and baby in our communities master this truly vital skill? Thank you so much for joining me on this explainer today. I really hope this deeper look changes how you see this incredible biological process. Keep learning, and I'll see you next time.